Your lumpkin.
Okay, so I pulled up the slides for today that I'm going to go through. So thank you very much, Victoria. Can people see the slides as they're listed on your screen now?
Not yet.
Not yet. You should be able to see them.
It's coming.
Now, right?
Perfect.
Everyone can see the slides. I'm going to go through a variety of slides today. So thank you, Victoria, for the introduction, and thank you for the opportunity to come present to such an interested group. And I know we have over 100 people in attendance today, and I wish we could be in person, interacting and talking with each other. But I will tell you that I love talking about this topic. Medications are near and dear to my heart, and I spend my life trying to make medications as safe as possible, especially for those older adults. And I spend a lot of my time trying to educate prescribers on how to be more informed prescribers of medications. So again, what I'd like to let you know is that I have no conflicts of interest, and I will kind of share as much knowledge as I can today with the group, and hopefully get you active, engaged, and empowered to take control of your health when it comes to medications and the safety of those medications. There's 5 things that I want to accomplish today. One is to raise your overall awareness as either actually a senior, as a caregiver, as a loved one taking care of someone who is an older adult. Raise your awareness about the issue of medication safety and what happens in older adults, and the framework for how you could begin to dialogue and discuss with your healthcare team around what we call the 4 M's, and I'll share that with you. I want to discuss why older adults have changes in their systems and how that could affect medication safety and what that means. I'd like to review the common medications that we often see in practice that are prescribed for common ailments or that you might take as part of your self-care strategy, and how they may pose greater risk for you unbeknownst to you because of those body changes. I want to impress upon you the value of having a medication checkup. Okay, and this is kind of a new avenue that's being introduced into practice, is making sure that there's at least annual, if not more, medication checkups for older adults because of that risk side of the equation with medications. And then lastly, I'd just like to talk about where you could get more resources and how you could become more engaged in the process with your physician or provider. So this first slide is to share with you just a shock and awe. So again, I've been in the industry working on the provider side and the consumer or client-facing side with the senior centers here in the city of Chicago and the area agencies on aging for over 25 years. And I could tell you, most of my time is spent around the risk side of the equation. And the reality of that is because you could see some of these data on these slides. There's over 5 million older adults that have sought medical attention for an adverse drug reaction to a drug. 42% of older adults take 5 or more prescriptions at any one time. And why is that important? Because once you're on 5 or more medications, your risk of a drug interaction goes up exponentially and approaches 100%. And again, that means drugs are going to be managed differently in your body. Over the last 2 decades that I've been practicing, there's been over a 200% increase in what we call polypharmacy. So taking 5 or more chronic medicines. A lot of these medicines can lead to adverse drug reactions leading to a hospitalization. It's a high cost of those hospitalizations, and often, in some cases, it could actually accelerate or contribute to an unfortunate outcome. So these are staggering statistics. But again, we prescribe medicines. Your healthcare team prescribes medicines for ailments, for symptoms, for conditions, for health conditions for you. You decide to take medications, whether it's over-the-counter medications, supplements, or herbals to treat a symptom or to treat a condition. And what I want you to make you aware is that these can be part of the problem and not necessarily a solution. We need to make sure that they're thoughtfully prescribed to you, and that you should have periodic checkups of those medicines, because as your medicine becomes more complex, your regimen becomes more complex, the likelihood of a problem becomes more complex. And so what I want to do is, the overarching theme here, and what I want to impress upon you, is that there's really 4 M's that really matter. And the most important thing is making sure that you as a patient can, or you as a participant that working with your partner, with your doctor, your healthcare team, you convey to them what's important to you, what matters to you about your overall health. Okay. And a lot of this has to do with, your family life, your culture, from whence you came, your faith. A lot of that goes into your decision making around how to care for yourself. And I think the more you could share with your provider what matters to you, the more we could start putting medications in the context of that. Because when we prescribe medications based on a complaint or a symptom or what we think might be the best approach to manage a medical condition, we're prescribing it with the intent that it's going to meet your goals and it's a shared decision making. But what's important to understand is that when we add a medication to your regimen, it can affect your mentition or it could affect your mobility. So all of a sudden now we're adding a medicine to treat a condition, but that medicine could have positive effects on that condition, but it could have negative effects on your brain health or your mobility, your ability to function. And that usually plays out in terms of adverse events or side effects of drugs. And I could tell you that the number of drugs that a patient is actually taking is the single most important predictor of harm. And remember, I said, once you're on about 5 or more medicines, that risk of adverse events or harm goes up. And I want you to be aware that there's specific drug classes that we use to treat medical conditions that may pose a higher risk. And that the fact that that risk is out there means we have to do something about it. And so I've been working in this space for over almost 30 years, and I work with providers and prescribers to try and make them more informed around medications and the safe use of those medications when prescribing them in older adults. But I will tell you that we often don't have a lot of data, and often we don't train our future practitioners and prescribers enough to help them better understand the subtle nuances of using a medication in someone like you, an older adult. So again, this 4M model of what matters to you, the importance of the medication in the context of your mobility, your function, and your mentition are very important as a framework that you can use to think about medications, as well as engaging with your healthcare team. So now we get to the substance in terms of, I've given you some of the data that says that medications pose a risk. We try to use them for their benefit, but when we have a lot of medical conditions, we have a lot of problems, a lot of medications, we could often have problems. So why does aging create problems with medications? It's typically because when we study medications and bring them to the market, we study them in younger, healthy populations. And when we get the medicines out in the real world and we prescribe them in patients with kidney disease, liver disease, frail people, older adults, pregnant women, people with liver failure, all of a sudden that medicine acts differently. So in an older adult, it's important to understand that all of your systems of your body generally slow over time. In reality, it's at the age of 40, every organ system begins to decline and begins to age. And so your brain health and your brain structures begin to decline over time. Your heart system, your blood system, your circulatory system, your digestive system begins to decline over time in terms of its function. And that just happens with normal aging, okay? And usually it happens every decade of life after the age of 40. And the two most important systems when it comes to medications are your kidneys and your liver. And the reason for that is we give you a medication, we prescribe that medication, you access and take that medication on a regular basis to control a condition or an intermittent basis to control a symptom. And that medicine is either metabolized in your liver or eliminated in your kidneys. And that's how the body sees that medicine. It sees it as foreign. It's going to try and metabolize it or eliminate it through your kidneys. But if your kidney function declines or your liver function declines, all of a sudden that drug can accumulate in your body. And so it's very important that when we use medications in an older adult, we use lower doses and we go slower because we don't know what that drug is the effect that's going to have on you, given the changes that occurred in your body. When we look at all the medicines that are used, typically 50% of them are probably cleared by the kidney and 50% of them are cleared by the liver, which means that as you age, those medicines are going to have to be adjusted to accommodate for some of that decline. And as providers, we actually measure various systems in your body to see if there's some decline in that system, and we try to adjust your doses accordingly. But again, the reality is, as you age, more problems occur. As you become more complex with your medical conditions, we often add more medications. So let's take a look at some of the conditions that occur with aging and some of the challenges. So usually for individuals over the age of 65, almost 80% of those people have 2 or more chronic medical conditions that require drug therapy. Some of the challenges here is that most medical conditions require more than one medicine to treat them. And so what that means is, if we control your blood pressure, we might need 2 or 3 medicines. Or if you've had a stroke, we might need to add 1 or 2 medicines. If you have high blood sugars, we might need to add 1 or 2 medicines. And all of a sudden you're on 5 or more medicines, and that 5 or more medicines then creates a problem for drug-drug interactions of those combinations. And then you add and layer in the fact that some people choose to make their own decisions for their health and use self-care, where they might go into a store and take an over-the-counter supplement. They might take vitamins, they might take minerals, they might take natural products or herbal products, depending on the culture and depending on your health belief. And so it's very important that you understand that those are all part of your medications. If you're taking supplements, herbals, vitamins, minerals, these types of things add to the medications that you're taking. And so often when I see patients that come into the clinic, or I see us in the clinic, or we see them in the hospital, typically they're on 5, 6, 7, 8, 9, 10, even 15 meds, sometimes 20 medicines. And you can only imagine that those medicines are interacting in ways that may or may not have a good outcome for you. And so I think it's very important that you keep a master list of your medications. That master list is something that you hold on to and retain. You keep that up to date. You bring that with you when you go to the doctor. You bring your medicines when you go to the doctor, so you can have a very thoughtful and deliberate conversation about your medicines and have them reviewed in what we call this medication checkup. So let's dig a little deeper into these side effects or these adverse outcomes that could occur. So I have this slide up here with a picture that shows a road map that goes all over. You could take one road and you could take a series of medicines and you have more fatigue or you're more tired. You could take another medicine or another combination of medicines and get more confused. Some people fall. So I have patients who come, they suffer 1 or 2 falls in the home. They come into the hospital and I see they're on a lot of medicines that might have contributed to that fall. And could we be more thoughtful with how we prescribe that medication? Sometimes there's disorientation or confusion, or sometimes there's even memory loss. So medications could actually affect the brain and could actually cause some degree of confusion, some degree of disorientation, some degree of memory loss just by virtue of how they work. So I'd like to stop here for a minute and see if there's anyone that wants to write in the chat any comments here. So for all of you listeners and for people on the call, have any of you ever felt that you've been prescribed a medication or taking a series of medications where you think there's a new symptom that you may have, or a change in behavior, or you think that medicine may contribute to your memory problems?
Yes.
Okay, so I'm hearing some people say yes. Sometimes they're commenting on falls and confusing.
Headache.
A lot of this is familiar to me. Sometimes it causes a headache.
Heart palpitations.
Heart palpitations.
Dizzy.
I get dizzy. I have a dry mouth
Dry
sometimes.
mouth, yes.
Loss of memory.
Nervousness.
Little agitation, nervousness, anxiety. Groggy.
Loss of memory.
Unmute.
Yeah.
Shortness of breath.
Okay. These are good. Let's stop there.
Hyperpigmentation.
Yeah. So why don't we mute again, and I'll comment and reflect on that. What I find remarkable is that there's no shortage of people that kind of joined this conversation and said, wow, some of these things you're talking about make sense. I've had medications, or I've had symptoms that I thought might be contributing, that might be new symptoms that might be associated with a med, or I have had medicines that make me feel like this. And there was no shortage of people that said, oh, they make me tired, dizzy, palpitations, dry mouth, anxious, nervous, memory loss. These are all potentially side effects of drugs that could be contributing or clouding the picture. And one of the challenges we have here as providers is that we might prescribe a medication or a series of medications for you. Over time, those medicines might cause some risk or some safety issues, and you might have some effects, some of which you're describing today. And we might look at that symptom as being another medical condition and add another drug and actually make things worse. And that's called a prescribing cascade. So again, I spend my time daily trying to teach prescribers and providers on what that prescribing cascade is and not to do that. If we see a new symptom, a new behavior change or confusion, disorientation in older adult, we should expect or assume that that's a medication causing that. And maybe we need a lower dose of that medication, use it less frequently to try and look at that drug being a potential cause of that side effect or that adverse symptom. So thank you for sharing all those comments. Again, there's no shortage of this, and I think we could talk the rest of the time about this. But let's move on and talk a little bit more about how those symptoms can create problems. So when you're looking at the brain, there's a variety of symptoms that can be caused by medications that we look for, especially in the older adult who are on a lot of what we call polypharmacy or 5 or more chronic meds, because you could lose your ability to concentrate, lose your ability to think, have a harder time comprehending things and learning new things, remembering things. And these may be reactive cognitive reactions to side effects of drugs. So I see a lot of this in the hospital where I'll see an older adult that suffered a fall or an older adult that just didn't seem right and had confusion. They showed up in the hospital and I take a look at their medicines and we review their medicines and say, well, there's some medicines that might be at higher doses or more frequent than we'd like. We probably should try to control their medical conditions with lower doses or fewer drugs. And so again, I try to make sure that the prescribers are more informed to make more thoughtful decisions around prescribing. And oftentimes these could get mistaken as a new diagnosis of dementia or Alzheimer's disease. And so again, it's a caution I try to help with educating our prescribers on. And it's also what I'm trying to share with you is that as a patient of a doctor or a patient in a hospital or a family member looking after someone else as a caretaker, just because someone might have confusion, disorientation, or memory doesn't mean they have a diagnosis. It might be a medication causing that. So I want you to think through that. It's well documented over the last 20 or 30 years which medications are more likely to cause harm in older adults. And again, this is primarily because when we study a drug, we study it for its benefits, and we usually study it in younger, healthier people. But then that drug gets out and is prescribed across a population, and with older adults that might have some kidney or renal function changes, or some cardiovascular changes, or some liver changes, that drug acts differently in you. And so what we've found through the years is that certain medications like antihistamines, so when you have allergies and you're taking over-the-counter antihistamine, such as Benadryl or chlortrimeton, these are medications that actually may cause more harm than good. There's medications that can create nervousness and anxiety medicines to treat depression. These may cause increased risk of that confusion, disorientation. Medicines for sleep, medicines for depression and bipolar disorder, muscle relaxants. So you could maybe have a fall and a fracture and take some medications for pain and a muscle relaxant, and that muscle relaxant and that pain medication could actually create some problems. And then sometimes a lot of people, as they age, they get incontinence or they have urinary leaking. They have to get up multiple times to go to the bathroom at night. And some of the medicines we use for that could actually cause problems. So what I want to press upon you is that when we start adding medicines, your medicines get more complex. You have more health conditions. Your care becomes more complex. You self-medicate with over-the-counter medicines or herbals. You may or may not add alcohol into that mix. This is a setup for a risk side of the equation of a drug, and it could lead to confusion, disorientation, changes in your brain and a perception that you have memory loss or memory impairment. And so it's important that you understand that. And I will tell you that I try to teach the next generation of prescribers these principles to understand that we use less drug, we think non-drug therapies first, we use lower doses, and because we want to make sure medications are as safe as possible, it's the right drug at the right dose in the right frequency for your patient based on what matters for them. So we're not affecting mentition, affecting your mobility because of the medication. So again, let's open this up to the people listening today. So I'd like to hear from you. Do you have any ideas of how you or your caregiver, or you could help a neighbor or a loved one you're caring for, can share your concerns about medications and possible problems with team members? I'd be curious to see what you have to say.
I had an issue. I think I want to also piggyback on what you said, because I think sometimes with medications, and you said alcohol, but also certain foods can also trigger different, strange reactions also. Medications coupled with certain foods.
Excellent. So I'll comment on that. So I'm seeing that some of the chat is saying that some of my clients or some people I know take a lot of herbal products, and these could potentially interact possibly with symptoms. So a lot of self-care management of over-the-counter medicines. People take, I mentioned alcohol as being a contributor, but sometimes it's very important to understand that foods, just the food you take, interact with drugs. And so those are, instead of a drug-drug interaction, it's a drug-food interaction. So when you get a bottle from the pharmacy and it says take on an empty stomach, or take the same time every day, or make sure you take it with food, there's reasons for that. Or avoid antacids, because sometimes that totally negates the effect of the drug or could worsen the effects of a drug. And so that happens all the time. And some common medicines that patients may take that are interacted and affected by foods, a lot of times some people have a thyroid condition and they take Synthroid. Well, that really has to be taken the same time every day, once a day, every day, the same time every day on an empty stomach. Because if it's taken with food, there's an interaction and it won't be absorbed. A lot of times antibiotics you're taking for infections interact with food and antacids. So it says take on an empty stomach. They do that because that medicine won't even be absorbed consistently, and therefore you'll never get the effect of the drug. So good point about the food problems that could occur as well.
We also had a couple of comments. Someone mentioned a psychiatrist being able to go through and they can communicate with that individual when they have questions about medications. And a couple of questions came in. One was asked about who on the healthcare team would be equipped to do a proper medication review.
Right. So in my chat there, I said, who might you talk to, right? Who might be that team member you talk to? And what I want to impress upon you is that there's a lot of people you could bring this to the attention to, right? So first and foremost, the most important person to bring it to the attention to is the person who prescribed that drug. So if that was a physician who prescribed that, if it was a primary care doctor or a psychiatrist or a physician assistant or a nurse practitioner, there's a lot of people that can prescribe. Your dentist, you would talk to that individual person who prescribed that drug, but you could also bring it to the attention of a lot of different people on the healthcare team. So as pharmacists, when you go to fill that medication, you could always bring that up to the attention of the pharmacist. You could bring it up to the attention of the nurse on the team. You could bring it up to attention of the home care aide that comes into your home twice a week to help you with your medicines. And all of these are mechanisms to get that information to the right person. And because from my standpoint, if you have a new behavior, a new symptom, and you were recently prescribed a new drug, or the dose of your drug was changed recently, or you began taking another over-the-counter medicine or something you took, there could be an interaction that's leading to some of this confusion, disorientation, some changes in your memory, and it's very important. So the issue of the psychiatrist, when we talked about the medicines that actually can cause problems, medicines that cause problems with memory are most often medicines that what we call get into the brain. Not all medicines get into the brain. You take them, you swallow them, they get absorbed, or you put a patch on and they get absorbed, but only some medicines go into the brain and work. Any medicine in neurology or psychiatry works by getting into the brain. And then a lot of these other drugs that have side effects get into the brain and cause those side effects. And I've given you a list of all those high-risk meds. So seizure medicines, insomnia medicines, medicine for to help you sleep, to help with agitation, to help with depression, to help with Parkinson's disease, to help with neuropathic pain. All these medicines get into the brain and they can cause issues with memory, disorientation, confusion. So good input and good questions. But what I want to help you understand is that anyone in your healthcare team could be a point of entry to communicate that to. Okay? So what can you do? So what I'm trying to do here is to try and make this as proactive as possible for you. You know, so again, half of my job I spend working with older adults and healthcare providers that go into the home of people and help educate them to be more informed consumers, more informed in the face of a lot of uncertainty. We think we know a lot about a medicine until we get it out and we prescribe it in the population, then we begin to learn about the side effects of that drug. So we have to be very thoughtful and deliberate in how we dose medications in the older adult. And you as an older adult have to advocate for yourself and help communicate with your provider what's important to you. What's important to you in terms of your overall health, and how does this medication fit in? Okay, how does this medication fit in with what's important to me? How does it fit in with my mentation? Okay, so what I'm advocating for you is you develop a plan. So you need to make sure that you have a master list of your medicines and be comfortable and confident, including the use of over-the-counter medicines, vitamins, herbal supplements. We have patients admitted to our hospital on a weekly or monthly basis that take a lot of these supplements that could actually cause some of their problems, and they interact with some of the meds. So it's important that you have that master list. If there's anything that's changed between your last visit with your doctor or healthcare provider, you should let them know, especially when it clouds your cognition, because your healthcare provider needs to know that so they can make the best decisions for you in terms of which medicines, what dose, what will be the optimal dose and strategy for you. What I've put here is a list of questions you could actually talk to your doctor about. But what I'm advocating for here is for a medication review or a medication checkup. I think it's absolutely important as part of Medicare. There should be an annual wellness visit as part of that, and you should have your meds reviewed at least once a year. I actually advocate at every appointment you have with your medical provider, you should show them that list and make sure that those medicines are in line with what your goals are and what matters for you, and not affecting your mobility and not affecting your mentation. And I call that medication checkup. And you should advocate for yourself. I really think that when you have a new symptom or a new medical condition, the first prescription should be no prescription. What could I do in addition to a medication to help with my sugars, to help with my heart, to help with my symptoms that I'm having with my pain? What can I do from a non-drug therapy standpoint versus a drug? And if you're going to use a drug, what medicine would be the safest for me? And when you go for these medication checkups, you should say, do I really need to be on all these medicines? And be open to the fact that you were put on these medicines by sometimes one doctor or multiple prescribers, and they may not be aware of all the medicines you're on, and sometimes they interact. And so my take-home message for you is a strong one. What I want you to understand is that as a provider, as a healthcare provider, as a healthcare member of a team, there's lots of members of the team that could help you. It could be that home healthcare worker that visits you in the home and looks at your medicines, help you prepare those medicines. It could be a caretaker, a loved one taking care of you. It could be you yourself. You could be working with a nurse, a CNA. You could be working with a pharmacist. You could be working with your prescriber and doctor. But we're all part of a team that's trying to make those medications as beneficial as possible for you to control your medical conditions while minimizing that risk. And what the data shows us is that the risk side of the equation tends to get become more common the more medicines you add, the more medical conditions you have. So it's very important if you want to optimize or improve your overall health and well-being, you want to be on the fewest amount of medicines at the lowest possible doses, at the least possible frequency, paying special attention to the combinations of drugs that could affect your mobility and it could affect your mentation, those 4 M's, right? So what matters to me, doctor, is this. What matters to me is that, it's important to me that I take a drug that has the fewest side effects, that's only once a day, that is the most cost effective, because if it's too costly, I can't take that, and then be honest with your provider along those lines. So share what matters to you and what's important to you with your provider. And again, your provider is well beyond just the prescriber. It could be with your pharmacist, the nurse, the home healthcare worker. Always maintain an awareness that you should be asking questions or sharing that decision when prescribing a drug around medication safety. I always tell prescribers the first prescription for a medical condition is no prescription. What can I do in addition to a medication or instead of a medication to help control my symptoms? But granted, sometimes you have an acute event, you have infections, you need to take antibiotics, you have a fall and a fracture, you need to take pain medications, you have high sugars, or you have a stroke, you have to take medications. We just want the safest doses, the safest medicine for you while trying to minimize that risk. And that becomes a discussion with your healthcare team. And if you're ever having trouble with your managing your medications or worried about any new symptom, and it may be a side effect to your medications, always ask your provider for a medication checkup. You have a right as a consumer, a right as a patient to have your medications reviewed, and then be very open, honest, and candid about what self-care techniques you're using, over-the-counter medicines, supplements, herbals, and alcohol that may be interacting with that. The one thing that I do see lately is that we're seeing more and more older adults who have chronic pain syndromes that are experimenting and using marijuana. And so again, that's a drug. So we need to make sure that that's part of our understanding of something you're taking. There's nothing wrong with that if you're using that and you chose to do that. We just need to talk about why you're making that decision, what benefit you're getting, and we may need to adjust other medicines on your profile. And so with that, I'd just like to share with you some take-home messages, what's important. There's some slides here, and there's handouts that you will be provided through this program that have resources for you. And I think these are wonderful resources to learn more about this. And I've got a couple slides here with those hyperlinks, and those hyperlinks are part of those handouts, and I've added a few extra. So there's a lot of resources that you could have access to learn more about your medications yourself, but certainly have those discussions with your provider. And so right now it's about 10 after 11, and I wanted to leave some time for individual questions or other questions that came up in the chat that I could address to reinforce some of the issues we talked about today. So
Thank
for
you.
Victoria, Danielle, monitoring the chat, just give me an idea of some of the questions. And if there's someone who raised their hand and wants a question, I'll be more than happy to address it.
Right.
Well, I would like to ask a question. I would like to ask the question. Hello?
Go
Yeah.
ahead.
If your physician tell you to take simvastatin, some blood, a pill for high blood pressure, either a pill for cholesterol, then say fluoric acid for they know what they are talking about, right? Hello?
So I'm listening. The question has to do with you taking a medicine for your cholesterol.
Right. And high blood pressure
Okay.
and fluoric acid for a definition.
So a vitamin,
So-
like folic acid. Okay.
Right. So now if your physician tell you to take those, it should be all right. Should
It's an excellent question. So, in working with seniors and older adults and just people in general through the years in my practice, what I found is that they'll say, well, if my doctor prescribed it, then I should take it. And I shouldn't question my doctor and I shouldn't question the prescriber. And I'm not saying to stop medicines, but what I am saying is that as you age and become older, your body systems change. And the way that drug is utilized, the way that drug works in your body changes. And as you age, we have to keep relooking at that medicine to make sure it's the right drug at the right dose, at the right frequency for you. And what we find is as people age, your blood pressure medicine requirements go down and your blood sugar requirements go down as your kidney function changes. And so those medicines always need to be evaluated. They're the right medicines for you, but it might not be the right dose. And we might need to change that. And so we prescribe that drug for a reason. We need you to take that for a reason to decrease your risk of strokes and heart attacks in your case by taking those blood pressure medicines and the cholesterol medicines. But those meds need to be continually evaluated as your body systems change. And we need to make sure it's the right dose. Okay, so hopefully that helped explain that.
right. Thank you.
Yeah.
We have a good question, which is pharmacists are often more available. How can we work best with them?
Right. So, there's I want you to understand that pharmacists are part of your healthcare team. Whether you're going to the pharmacy and picking up that prescription, or whether the pharmacist is working directly with your provider team in the primary care clinic, or whether the pharmacist is working in the long-term care facility or the assisted living facility, that pharmacist is part of your team and they're advocating for you. And behind the scenes, they're actually screening all those medicines for these types of reactions and these types of problems, okay? And they get alerts for that. And sometimes they communicate directly with your doctor and sometimes they communicate directly with you. So I want you to understand that this is one of the reasons why we ask you to go to one pharmacy and one pharmacy only to get to establish a relationship with your pharmacist and realize that behind the scenes, they're actually advocating for you and screening for some of these interactions and reviewing your med list to make sure that it's optimal for you. So if you don't feel right on a new medicine, especially if you start a new medicine or change your dose of a medicine, something doesn't seem right, you can't get a hold of your doctor, talk to your pharmacist. They may be able to at least guide you or get in contact with your doctor in more meaningful ways. And so I will tell you that the computer system is starting to connect all of the healthcare providers. And the more you could convey it to a healthcare provider, the more that we can act on that and communicate that to the prescriber for you. Okay?
Question.
Thank you.
Okay,
Dr.
I
Mike,
got- hold on,
Dr.
hold
Mike.
on, hold on. I am going to
Dr.
ask
Mike.
excuse me. I'm going to ask one more question from the chat, and then I'm going to move to Annette, who has had her hand up. If you'd like to ask a question, just put your hand up, okay? And I'll
Dr.
scroll and see.
Michael, I can't raise my hand. I am on phone. Can I ask question?
You're on the phone?
Yes,
ahead.
I am on phone and I can. Okay, thank you, my dear. I have a question. According to recent researches about people 65 plus, doctor, as I heard, doctor will not recommend it anymore. Baby aspirin, is it right?
So the question came in about the use of taking low dose daily aspirin, like a baby aspirin every day. And
Yes.
it really boils down to a discussion around whether you're using it for primary prevention to prevent a stroke and a heart attack, or whether you've had a
Yes.
stroke and a heart attack, and now we're trying to prevent the second one. And what we do know is the data, the evidence around aspirin is beneficial in patients over the age of 70 if they've already had a heart attack or a stroke. If they've never had one and we're trying to use it to prevent the first one, the risk of bleeding outweighs the benefit. We don't recommend it anymore. Does that make
Okay.
sense to you? So again,
Okay.
it's really a
It
shared
means-
decision-making with your doctor.
Yes.
So this is an example how you as a consumer could start taking baby aspirin because you heard it was
Okay.
good and not realizing that it could actually be too risky for you because you're trying to prevent that first stroke or heart attack and the risk of bleed is greater. So good question.
Yes. Yes. If I try to prevent, I don't have to use anymore. Yeah.
That's correct.
Thank you. Thank you, Dr. Michael. Thank you.
Okay, the next question is, I'm taking herbal teas and vitamins. Could this have an adverse effect on some of the tests we have to take at the doctor's office?
So the answer to that question is pretty straightforward. Herbal teas are historically a study of pharmacy we call pharmacognosy, which is a study of medicinal compounds from plants. And so cultures that often drink these herbal teas and herbal treatments realize that there's actually active ingredients in there that are actually doing things. And so the answer to that question is yes, herbal teas could interact with medications that you're taking. It could actually interact with underlying conditions. An example of that would be, we could take dementia or memory loss, right? Sometimes people take herbal products and herbal teas that contain ginkgo in them to try and stave off memory loss. But yet that medicine, that herbal tea has never been shown in a trial to actually improve and delay the onset of dementia, but yet it can cause bleeding risk and problems with the liver, and it interacts with drugs, especially anticoagulants or blood thinners. So that gives you an example of an herbal tea for memory might cause problems with your med. So it's important that the providers understand you're drinking herbal tea. It's okay. We just need to know that, be aware of that, and adjust medicines accordingly, and begin to have a conversation about why those herbal teas matter to you and how that could be part of your overall treatment plan. So again, just be open and honest in terms of supplements, herbs, teas that you're taking. Thank you.
Thank
you.
you.
Now we'll go with Annette, if you can unmute, and then Angie will be after
Can you
that.
hear me? Can you hear
Yes.
me? Hi. He had mentioned that there are some patients that may take anywhere from 7 to 15 medications. And I was wondering if this has a cognitive effect on a person, how do they go about assessing what to take less of or what not to take? Because there's so many medications involved.
Right. So the question is surrounding, when someone has a lot of complex medical conditions, they're an older adult, they're on what we call polypharmacy or 5 or more chronic medicines. And that's most people as they age, unless you're aging successfully. This is why I'm reinforcing the importance of a medication checkup. Those medicines should be reviewed at every point in time in the system. So at least once a year from your primary care doctor. Each and every time you go in and out of a hospital, each and every time you go to an urgent care clinic, you transition out of a hospital and go to an assisted living or a nursing home, you go from a nursing home to a home. You're in and out of a system of healthcare often in those processes. But at each point in time of those changes, your med should be reviewed because what we try to do is make sure you're on the lowest effective dose of a drug.
Okay.
The lowest effective dose of a drug. And if we could actually do a dose reduction or get you off of that medicine, we would prefer to do that. And again, an example of that might be we treat your blood pressure in your 30s and 40s and 50s and 60s with 2 or 3 medicines at these doses. But now when you're 75, 80, 85, you actually require lower doses.
Okay.
And we might not be adjusting those, and that low blood pressure might actually be contributing to a fall or confusion because you're not getting, we're lowering your blood pressure too much.
All
Or we
right.
treated your diabetes when you're 30, 40, 50, 60, but now you're 85. We don't have to control your sugar as aggressively when you're 85 than when you're 30, 40, 50. So we might need to lower your doses. So what I'm advocating for is just being very open and honest to have your meds reviewed. You have a
Okay.
right as a patient to have your medications reviewed. There's a systematic way to do that. It's called medication therapy management, or this medication checkup. And the only way to do that is to have someone spend time to do that. And I will tell you that it's embedded in part of Medicare. It's embedded in part of your insurance. Older adults who are on 5 or more chronic medicines, actually behind the scenes are having your meds reviewed and you don't even know it. And so
Oh,
we are
okay.
trying to change systems to make medications safer for you. Pharmacists behind the counter filling your prescription is actually screening and doing those reviews without you even knowing it. We're trying to make medications safer. But if you have a new symptom, you need to bring it to our attention because it could be one of your medicines.
Thank you.
All right, Angie, if you can ask your question, and after you, the person designated as safe human will ask her question. Go ahead, Angie.
Okay. I don't know if you can hear me. Can you hear me?
I can.
Okay. So this is around safety. We do a lot with opioid addiction, and we know a lot of seniors have had surgeries, and they have a lot of pain medications and narcotics that they may no longer be using. So every year we talk about drug give back. Do pharmacists usually take back medications that a person may no longer be using, or narcotics that they were on for surgeries and they discontinued? How would you best advise our seniors on how to properly dispose of those medications so that they don't fall in the hands of a relative or someone visiting that may use them for ulterior purposes?
It's an excellent question, and it revolves around the safety of medicine, not only for the patient, but the safety of the medicine in the home and other people who could actually take that medication mistakenly. We at the university here in the College of Pharmacy are doing 2 major initiatives across the state around exactly that, those pain medications and the safety of those in the home. It's called Safe Home, and we're working on that project now, where we use home healthcare workers to go in to help educate seniors on the risks of those medicines and possible diversion of those medicines. But the best advice I could give you is that the system is now set up nationwide to have medication take-back programs 2 times a year, so every 6 months. And that's in April and October. And so every April and every October, there is essentially a national medication take-back day. That national take-back day is twice a year, and it's usually blitz advertised and campaigned across the country. And it usually ends up being through either a fire department or a police department. And it's called medication take-back programs. It's in April and October. Now, some pharmacies might be okay with that, and they might take your medicines back and they'll just go to that session and do that. But really what we're trying to do is create a national system for take-back rather than a random system just from pharmacies and things like this. I would say if you're no longer using medicines, secure them in a safe place where no kids or grandkids can get access to that. The issue of pain medications and opioids is a real one. And the challenge with opioids is we start those medicines post a fracture, post a dental procedure, post a hip fracture, a surgery. And the most important point is not refilling that prescription a second time. So the Canadians have taught us that if you fill that prescription for that opioid pain medicine the second time, like a refill, then you're more likely to become dependent on that medicine. And then that medicine will have risk. And so what we try to do is prevent the second prescription of that opioid pain medication from being filled, particularly because we know that that's the greatest risk if you fill it more than once. And we expect postoperative pain to be less and less. Now, I know we're not going to have enough time for all the questions. And every time I go and give talks on this subject, we could talk for hours, and I want to address all your questions. For those of you who have put questions in the chat, I appreciate it. I think what we could do is we could ultimately, I could grab that chat and maybe respond to those and send that responses to Victoria and Danielle in some meaningful way. If you didn't get your question answered today, just be mindful that you know who you could talk to. You could talk to your healthcare team about it, right? and make sure that they understand what this is important to you. It matters to me. And I want to make sure that the medications I'm on are the safest, the right drug for the right dose, the right frequency for me. And if there's lower doses or other drugs or non-drug therapies I could use, I want to know about them. And I want to make sure these medications aren't affecting my mobility and my mentition. And again, I think I want you to activate yourself, engage, and realize that you have the power to talk around these 4 M's and begin to have that discussion with your provider and or your the nurse or the pharmacist along those lines. And those medication reviews are essential.
Thank you very much, Dr. Koronkowski. We really appreciate you spending time with us today and covering how medicine and age affect the brain. And it's an important message that you're leaving us with, that people should engage with their healthcare team and be comfortable asking the questions. So Danielle and I will send that list of questions that you recommend people ask their providers to everybody who has been in this presentation and participating with us. And I want to make sure that people take a little bit of time now to do the post-test on the program. So Danielle will also send everybody the post-test. And then if you can complete that link, you don't need to do it right now. Danielle, is it in the chat yet?
No.
No, it's best. I think it's easiest if we send you the post-test via email. And then if you have the opportunity to complete, it's only 5 questions, but it does help our program evaluate itself and see whether this is the type of programming that is working and good for you. I do want to thank not only Dr. Koronkowski for his time, but also UIC for participating with us and being a partner in this program as well.
Do you think we had time to answer the person who's safe humane, because she did have her hand raised?
I think we do. Sure. Go ahead, since we had already called on you.
Well, first I'll explain Safe Humane. It's on my Zoom ID because I do a lot of court advocacy for my local district and my Safe Humane for the court case dogs. So it just automatically comes up. I feel that the doctors should actually talk to you about your diet more, because change of diet. I'm sorry?
Go ahead, somebody's unmuted.
Yeah, a change of diet can help some of us from taking some of the medications we do take, or reduce the strength of them because of the sodium intake, the fat intake, the meat, overeating junk food. Can change a few of those things that have started with us, that just changing that can keep us, well, possibly from not taking some of those medications. It depends what's wrong with you, of course. But if you're just starting to have a little high blood pressure or cholesterol problems, sometimes just being a little more careful. And some of the doctors don't even talk to you about the food.
Right.
And
so I think that's a great point, and I'm glad to echo your thoughts as well. I mean, the fact of the matter is, the first prescription should be no prescription.
Yeah.
That's the message I'm sending today.
Yeah.
You know, what else could I do besides the medication to control my blood pressure, to control my sugars, to lose weight, to help with the pain? There's a lot of non-drug things we could do to help with that. The mind over matter, a better diet, exercise, physical health, mobility, mental health, well-being, stress reduction, right? But if we are going to use a medicine, we do need to be cognizant that food can play and interact with those drugs. And again, behind the scenes, those interactions are being somewhat screened, and that's why there's labels that are put on your bottle to take with or without food and these things. But I'll tell you, there's a lot we don't know about those drug-food interactions. But diet is definitely, and what we eat, what we put in our bodies is essential to our health and well-being. So good point. Thanks for sharing that.
And
A
one of
lovely
the
message to end on. So Thank you very much for your
Dr. Mike,
time
Dr.
and
Mike,
participation. Any questions we did not get to, we will
One
try and
comment.
answer in the chat. So
One
once
com-
again, have a good
one
day, and
comment,
I
please.
appreciate everybody's attendance here. Thank you.
Thank you.
Dr. Mike, unfortunately.